The one area that I think probably galvanized us more than anything else was healthcare services for infants and young children. Trying to move to be more preventive as opposed to try and treat people after they were ill.
Issues around healthcare in Pierce County, especially for people of color, and especially for poor people, was very deficient. You didn't go to the doctor. You went to the emergency room. You didn't go to the doctor. You didn't have good dental care. And in many cases, it was a gateway to better health care.
My understanding is that there really weren't good primary care systems for low-income people. They ended up just going to the emergency room or the hospital to get their care.
Family physician or having the ability to go to a particular location was just about non-existent. The families who needed better health care were sprinkled among us. I mean, they weren't in one section and we were in another section. I mean, I would be with people who I had health care, and I just assumed that they did until something went wrong, and they said, well, I don't have health care. I don't have the ability to see a doc. I'm going to the emergency room. And these were not folks cordoned off into a particular section of town, but people who kind of came and went, had marginal employment, had good civic responsibility, because I'm doing a lot of volunteer work, and that's where I met a lot of people. And people who were out helping other people had no clear ability to help themselves when it came to issues related to health care. At the time, we also had a significant problems with illegal drug activity and drug participation, and people were having negative health outcomes from using drugs. Now, that section of the community was not part of any healthcare network, and if you have infections and diseases that are drug related, you're not willing to go and report that to anybody, and people kind of just suffered with it, and you saw a lot of very negative health outcomes for people during that time.
While the state of health care in Tacoma during that time was very, very poor, and we had areas of where population were being greatly underserved.